Assalamu alaikum. Good evening, everybody. I am happy to be here this evening with you. I am Harriet Lewis, Senior Advisor here at IMAN. And as you can see, we are not at South Shore Cultural Center this evening. We are starting our program inside of the currently being renovated IMAN's Federally Qualified Health Center. As you can see, it's under development. But we are excited about our program this evening. We're excited and thankful that you're able to join us. Again, this is a challenging time, and I know day after day, Zoom meetings, and you have taken the time out of your evening on a weekend to join us. And I want to thank you because it's because of you, our ongoing supporters, that have been able to make our work possible. Also, I would like to thank our sponsors who made this evening possible. Thank you. We have an inspiring evening plan tonight. You will hear many things about our programming from 2020, how we've been able to continue our work during this pandemic. One of the exciting things that you will hear is an inspiring conversation from our executive director, Dr. Rami Nashashibi, and one of the deputy governors, Sol Flores. But right now, before we start that amazing program, I'm going to pass it to my colleagues in Atlanta who will tell you all of the amazing things that have been going on in Georgia. Thank you.
There we go.
All right. All right. We had a little sound difficulty there, but hopefully you can hear me now. God's peace and blessings be upon you. Assalamu alaikum. My name is Mansour Sabri. I am one of the deputy directors for IMAN and the director here in Atlanta. I'm excited. I'm excited to see all of these beautiful faces this evening, and really honored to be able to just share a few things about what we've been doing here in Atlanta and Georgia. Very grateful for all of the support that has been given to IMAN in this extraordinary year, but over all of the many years in which we've been working. So we thank you. Our extraordinary team here in Atlanta has been hard at work, both meeting people and where they're needed and building power. From our Green Reentry Village apartments hosting families to our farmers market providing fresh produce to the community. You'll hear more about that in the video that's coming up next. But as you know, Georgia has been center stage in this election year, 2020. And I'm especially proud of the role that we've played in getting people out to vote. This has been the year where Georgia has mattered more than ever before in the votes of the people and the citizens of Georgia. And so we're really excited about what we're able to do. I want to pass the mic over to my colleague here, community organizer and activist, Sister Karima Hanifa, share more about the campaign work that we're doing in Georgia.
Thank you, Mansour. Assalamu alaikum. Karima Hanifa. I am an Atlanta native. I am as well the community organizer for IMAN Atlanta. We have been working really hard, raising awareness around the importance of people raising their voices during this particular election. We understand that while this is election season, that we must not drop the ball, that we cannot stop. We must continue to proceed forward. You'll hear more in the video about the campaign that we launched this year, the No Taxation Without Representation, which is the awareness that there are 266,000 disenfranchised citizens, which means formerly incarcerated individuals in the state of Georgia that are not allowed to cast a vote. But right now, we're planning and we're very excited about an event which is scheduled for January the 4th, 2021, which will be held downtown Atlanta on the steps of the state capitol. It is during this particular rally that we are asking everyone in Georgia to come out and use their voices and to be supportive during this particular election season, especially with our runoff elections coming up within less than a month from now. If you live in Georgia, go out and vote. If you do not live in Georgia, continue to keep us uplifted here in Atlanta as well as at IMAN, and keep us in your thoughts and your prayers. Thank you so much. Assalamu alaikum.
So in the meantime, let's make sure we are excited, and we here in Georgia and Atlanta, we're excited to hear this in-depth conversation with Dr. Rami and the Deputy Governor of Illinois. And we too will continue to engage our public officials and health professionals here in the state of Georgia as we move through this moment in time. God's peace be upon you all. Assalamu alaikum. See you soon.
Assalamu alaikum. Peace and blessings be upon you. Thank you, Mansoor. Thank you, Sister Karima, Sister Harriet. My name is Rami Nashashibi. I have the honor and privilege of being the executive director of this phenomenal organization here tonight on location on the south side of Chicago in our beloved community ceramic studio. I'm here with my colleagues, several of my colleagues out of an extraordinary staff you'll get an opportunity to hear from, and I'll introduce them individually later. And our star for the evening and our extraordinary guest, Deputy Governor Sol Flores, who we're just elated is here with us. As I looked at the opening of this program and I see the faces on the screen, I know you're gathered from across the country, individuals who have been supporting this organization since its incorporation in 1997, as well as foundations and members and organizers and leaders from Georgia, Illinois, from literally one coast to the other, who believe in the model that IMAN has been building over these years, who've been supporting this model, who understand the relevance. And when we think about model building, we think that all the extraordinary work that has been accomplished in Georgia, really in only 5 years' time, a full comprehensive green reentry village, a housing, comprehensive organizing training, arts and culture, and now a community organization that is responding to the critical urgency of the moment. Imagine, with all of these razor-thin results of the elections, what an additional 250,000, 250,000 people who would be enfranchised in the state of Georgia. Imagine what that state can look like in 2 years or 4 years' time when those voices, which are disproportionately Black and brown voices in the state of Georgia, are given the due right that they should have to be able to have their voices heard in an election. What an extraordinary work, what an extraordinary team. Thank you for all of those who are tuning in from Georgia, who've been incubating and supporting this model. Thank you for the donors across the country that believe in building that model in Georgia. I think we could all agree how relevant the work in the South is, especially in this time. And then to see my colleague, Senior Advisor Harriet Lewis, in the health center. You saw the wood frames, you saw the drywall being put up. It's just amazing to think that that building was acquired in 2005. And since that time, we've not only been able to see thousands upon thousands of uninsured, underinsured patients and patient leaders from across Chicago, literally over 30 zip codes, that have decided to hold IMAN as its healthcare home. And now we are undertaking one of the most expansive, comprehensive build-outs of our campus. And even as we have been building out that structure, we have been seeing patients in other buildings across our campus. You'll hear shortly from Dr. Sophia Adaria, the director of our health center, about all of the accomplishments that we've been able to proceed with, even in one of the most difficult and unprecedented years. But for now, and when we come back, we'll have a conversation with our deputy governor. But without further ado, I'd like to segue to a video that will give you a kind of overview of what this year has been like for us.
The warning from the CDC, the coronavirus is spreading so quickly around the globe.
To spread despite international precautions. Into its 7th month, more people are becoming food insecure.
The unemployment rate is
Just
skyrocketing.
last week alone, close to 250,000 workers filed claims
Since
for
Friday
unemployment.
night at 6 through midnight, a total of 12 people have been shot and killed here in
51
Chicago.
people shot over the holiday
10
weekend.
people in all were killed by shootings in Chicago.
A normal start
this weekend.
to this discussion would be say good evening, but it's not a good evening in our city right now.
This year has been a challenge. IMAN decided early on in 2020 that we were just going to take it as our mantra for the year that إِنَّمَا عَلَى الْعُسْرِ يُسْرًا, the Quranic injunction that reminds us that with every difficulty, there is ease. We decided to find the openings in that. One of the things that we knew would be at stake this year was fighting the isolation and the alienation of already vulnerable communities. The national cry was social distancing, and we immediately said, no, we'll encourage physical distancing, but social connectivity.
And this is every Wednesday from 4 to 5, right here on 62nd and Racine.
When I say how you feel, y'all say good, okay? How you feel, y'all feel. Say how you feel, how you feel. Anybody else would like to say? Anybody? Come on, sis. Yes.
We made sure our green reentry intervention specialists were equipped to do their street outreach safely, helping to spread awareness about the virus to people and get food and supplies and valuable information into people's hands.
What is your cocoon like right now? What are you worrying about?
We launched the Internet Cypher series to connect people across the country to artists and to each other. This year, we really saw the power of the arts to make a huge impact in the realm of social justice. We saw the launch of the album This Love Thing with IMAN's executive director Ramina Shishibi and IMAN roster artist Drea Denur executively producing this powerful compilation of music featuring several other IMAN roster artists, and using a song like Mama Please to help pass a critical piece of police accountability legislation in Buffalo, New York, called Carriol's Law. And it was artists and activists like Drea who were at the helm of that effort. When protests erupted across the globe after the murder of George Floyd, there was also a reckoning around the place of immigrant-owned businesses in Black neighborhoods, which is an issue that IMAN has been championing through our Corner Store campaign almost since our inception.
IMAN as an entity, it's right for us to be able to be the entity that mitigates, that step in to really kind of create a new reality.
Shortly after the murder, IMAN contacted our partners in Minneapolis, and we held a virtual town hall session with people from across the country, discussing the issue and unveiling the Corner Store Witnesses program.
Our curriculum designers and trainers will work with IMAN's team of experienced organizers and facilitators to develop 4 virtual trainings.
An effort to train corner store owners, organizers, and just everyday people on how to stand up to anti-Black bigotry in their stores and in their neighborhoods. All of this has had a severe impact on communities of color. We faced the bloodiest summer in recent history in Chicago. We lost 3 of the men in our green reentry program to violence.
When the pandemic hit, it was like 1 month, he was out of school. Out of that 1 month, out of 20 dudes, we lost like 4. We had 4 deaths. And 1 month of us not being in the space,
And at the same time that we knew we wanted to keep people safe from COVID, we knew we had to find a way to re-engage people in person. We started slowly bringing back participants in groups. And we've now institutionalized our Green Reentry Weekend Warriors as a 3-semester program in partnership with city colleges in Chicago. All of this happened in a year when IMAN was applying for the largest grant in our history. And though our initiative, Go Green on Racine, did not win the Chicago Prize, we developed and advanced the most detailed, ambitious, and thoroughly vetted plans in our history to facilitate a stunning new grassroots-led transformation of a critical intersection in the heart of Inglewood.
The whole point is to change this street and these blocks to make it look like something that we once knew. And we're gonna make it ours.
For 5 years, IMAN has been answering the question of how relevant this model is across the country through our work in Atlanta. We launched our Fresh Beats and Eats Farmers Market as a food box program this summer and provided stable housing to families in our Green Reentry Village. We took our reentry roundtable conversations virtual, gathering dozens of people across the country to have critical conversations about reentry. Of course, we can't forget that all of this happens in a very important political year. We launched the No Taxation Without Representation campaign this year to raise awareness about the 266,000 people in Georgia who were denied the right to vote. We'll be ramping up this campaign with thousands more signatures and working to turn this effort into meaningful legislation so that the next time we vote, over 250,000 people in Georgia have the right to vote with us. Inna ma'al usri yusra. We are so grateful that in this incredibly intense time, we experienced nothing less than humble generosity. And undoubtedly, the ease we found this year has in great part come from our community. That spirit and that support has been our lifeblood from the beginning. And we will continue to rely on that in the difficult days to come as we work to strengthen this organization into an institution that can continue to fight ceaselessly for lasting change.
All right, snaps and applause virtually for that extraordinary video. Much love and recognition to Impact Studio and our own communication team here at IMAN, led by Deputy Director Alia Bilal and Suhaib, who helped put that phenomenal video together. Hope that it gave you a just glance of what has been obviously an extraordinary year for many of us. And that theme of hardship and ease, the hardship and opening, recognizing that there's also another spiritual and Quranic tradition that the Creator doesn't place a hardship on us that we cannot bear. And we can only bear that collectively. And that, I think, the secret in that verse and secret in that tradition is that individually, those hardships do feel very overwhelming for any one of our communities who already feel isolated, who already feel under attack. But collectively, I think, is where the ease is. I want to start again by thanking you. You are perhaps one of the most important people in the state right now. You are in the thick of intense conversations all throughout Thanksgiving on deploying vaccines, on managing one of the largest line items in the state budget, presiding over health and human services. But so you have a background. I think you're here also because we relate to you as a fellow community organizer, as a nonprofit activist, as someone who was the own founding executive director of La Casa Norte, who really did this type of grassroots work for over 2 decades almost before you went into this extraordinarily important position at an unprecedented time. Tell us a little bit about what that year has been like and perhaps how your background as a community organizer, as an activist, as someone who's worked at the grassroots level has helped you get through what has undoubtedly been a very challenging moment for you, I imagine.
Yeah, well, thank you so much, Rami, for having me, and thank you to all your colleagues. It's such an honor to be here tonight to celebrate. I look forward to being together in person in the future when we can hug and kiss and shake hands and break bread together. So I'm really honored to be here in your space and to share the conversation. You know, for me, being at La Casa Norte, I always say was, you know, one of the greatest honors of my life to walk alongside young people and families as they were working on what they needed to have the life of their dreams, right? The very same thing that I had, the opportunities that I had and my family had. So it was almost 2 years ago, I remember the day exactly, January 6th, 2019, when then Governor-elect Pritzker called me to say, so I've been watching the work that you've done, really want someone like you to be in government. And most importantly, I want every little boy and girl in this state to see someone that looks like them working in my administration, right? And so while I look young, Rami, I'm not that young. So I definitely had those experiences. I'm sure like you, we're the firsts or we're those onlys, right? When I think about my 12-year-old, you know, Black Rican niece, Irani, right? And I think about the images that she's seeing and the experiences that she's had as a 12-year-old young girl and what I want her to walk in life, the path in life to see and know that she is valid, that her experiences, her background, her identity, and she sees it everywhere. And so for me, it was a real honor to say yes. That was first. And secondly, to take all the work and experience that I've done at La Casa Norte with the partners, with the mentors, with the leaders that I walk with and bring that to state government. And so needless to say, it has been an incredibly challenging 2 years. And of course, the pandemic has only compounded that. I feel very fortunate to work with an amazing group of individuals at the state. The governor has pulled together a group of individuals, first and foremost with Dr. Ngozi Ezike, who has been my very good friend for almost a decade, who comes to this work with faith in her heart, with a focus, with a compassion, to work alongside this governor who understands that the decisions that we're making for 12.5 million people, we don't make them lightly. And every day working to understand how are we holding our communities whole and safe. And so I would probably end by saying it's been incredibly grueling, just like a lot of other people have been existing in life right now. And I miss those things that all of us miss. And yet I'm lucky and feel privileged to be here, to be at the table, to bring a voice. And I'll just give you a few examples. You know, very early on in the pandemic, we knew that housing resources for people who are, you know, struggling or in a housing crisis was going to be very important. And so some of these bureaucratic leaps that we were able to make very early on to make sure we got resources to those organizations that are serving people experiencing homelessness so that they in their local communities can say, these are the solutions we're going to put forth. Maybe we're going to put people up at a hotel. Maybe we're going to rent out the Y. Maybe we're going to rent out Airbnb, but we're going to figure that out for ourselves. And so I felt lucky to be there in that role, in that position, say, we've got to do this. We've got to move on this. Another just very brief example I'll share with you is that around telehealth. So, you know, Illinois, unfortunately, you know, lagging for a long time and making some of those telehealth advances capable. And while we'd had law, we didn't really have the programmatics of how to do that. Again, it's amazing what a pandemic does do. So we're able to dismantle some of these bureaucratic challenges and allow people to have that opportunity to connect with their professional behavioral health care specialists. And we mandated it for folks who are receiving, who have private insurance, but also those individuals who are receiving Medicaid assistance here in Illinois. And this is the last thing I want to end with in terms of the opportunity to be there and be in the space. In June, after the George Floyd murder, and we saw all of the, you know, the protests, you know, our governor said, what else can we be doing? What else? What else? We know that the pandemic has only ripped off the Band-Aid of those inequities and inequalities when it comes to Black and brown people in the healthcare space. What else can we be doing? So we dug deep. working with our partners in the General Assembly. We got federal CARES money, and we applied it, again, in singular, localized ways. And, one very small program, it's small to us, but it's new, is called Healing Illinois.
Yeah.
And so we invested $5 million across the state for communities to have access to cash, to facilitate conversation, to bring people together, to say, what do I need to reach across, to understand from my neighbor what racial healing means to us?
Yeah.
And not that we had to pay people to have these conversations, because they were already happening, but this was a way if you needed to have a meal, if you needed to have hand sanitizer, if you needed to rent a space, if you needed to have equipment. And so that's never been done in this state before.
Yeah.
And we're taking these conversations. We hope to have had, thousands of conversations leading right up to honoring Martin Luther King, and taking those in as a state and say, what else can we do next?
Well, first of all, let me say this before I kind of ask any additional question, that for those of us who have been in the trenches, doing community work, leading nonprofit organizations, working in nonprofit organizations, it's often just extraordinarily, just kind of both absolutely beautiful, but also extraordinary burdensome life that a lot of people don't appreciate what you're dealing with around the clock. And so to see people have that pathway from working in the trenches, working with the most directly affected, often most vulnerable, often most historically disenfranchised communities, segue into such an extraordinarily important position in state government is, to say the least, absolutely inspiring. And to have a woman of color who understands Black communities, Puerto Rican communities, brown communities, community immigrants, who understands that spectrum from a very personal perspective and continues to champion those voices. I can't tell you how much that means to so much of us. It's not just about brown and Black faces in high places. It's about those faces that stay connected to those roots where they came from. And we're just so grateful that that connection remains very rich with you. But I want to speak to something that I want to ask you a question. And, on the thousands of conversations, I want to be honest in saying, look, the CDC just came out, the Center for Disease Control, based in Atlanta, just came out at the agitation of Senator Warren to modify the statistics about death disparities in the country. It turns out that Black specifically, and brown, but more specifically Black folks, are not dying at twice the rate of their white counterparts, but 3 times the rate of their counterparts nationwide. For those of us in a state like Illinois and in a city like Chicago, we've been studying these disparities for decades. I did sociology at University of Chicago. You could have an entire library talking about the socioeconomic health disparity gaps. Just a couple of years ago, the New York University School of Medicine came out with a study that looked at life gap expectancies in over 500 urban centers across the country, and found that here in Chicago, that the 8 or 9 miles between Inglewood and downtown presented the largest urban life expectancy in the country, 30 years. So we've known this stuff, Sol, and I'm all for the conversations, but we know what's at the issue. And I think what the frustration for those of us who've been doing this work is, it constantly, whether it was the heat wave in the 90s, whether it's the pandemic in this moment, it's the other socioeconomic disparities, the racial disparities, the criminal disinvestment in Black and brown communities that continues to lead to the staggering disparities. What radical interventions can we begin to make that go beyond conversations? Conversations is great, but what more radical interventions can we begin to make at even a state level with your leadership in the state? What do you hope to be making that begins to make the types of changes that are long lasting, that begin to really cut in to the systems that have created these disparities for so long?
Yeah, thank you, Ryan, for that. And it's horrific when we look at the death rates and the disproportionate impact that COVID has had on Black and brown communities. And to your point, those were always there, right? And COVID, again, has just ripped off the Band-Aid or put up a brighter mirror to reflect that. One of the things that we're working on, I think about right now, and wish that we'd already had this in place, right? But this is a long time coming in Illinois. It's something that has to happen in partnership with state legislature, something that we can't, the governor, the state, on the executive part can't do it alone. And that's talking healthcare transformation, right? What does it truly look like to transform the experience of healthcare delivery?
Yeah.
And that doesn't just mean taking my temperature or a shot in the arm. What it means is, do I eat healthy? Do I understand how to manage my diabetes? Do I understand what it takes for my kid to grow up who has chronic asthma healthily? Am I going to be worried about where I live? So thinking about a holistic approach to healthcare. I mean, that is what is needed in the city and in the state. Individuals have to feel comfortable that they can be in their own community, similar right here to like what IMAN has created, and they can have a health home, but they can also have those other things that keep them whole. That is what we need, I think, in this city, in the state, and in this country. And that, Rami, takes millions, billions of dollars to transform.
Right.
Like that's about building new hospitals, saving the hospitals we have, but it's also thinking critically and differently, like the work that IMAN is doing, again, holistically. I think that first and foremost is got to be what happens. We look forward to working on that over the next couple years, and we need partners. We need help in community to bring that forth.
Yeah. Well, I was going to speak to that, on currently tonight on Zoom, what we're really grateful for the philanthropic presentation, of support both here in Chicago, Illinois, and across the country of individuals that believe that, again, that perhaps the types of paradigm shifting models, I think at IMAN, we talked about this several months ago. We knew we were going to have to meet people where they're at. We're going to have to deliver the food. And we delivered probably over 80,000 pounds of food in 3 months. We had to provide housing for those young men who are coming out of Cook County Jail because of the overcrowding in Cook County or the overcrowding in state prisons. We had to respond to the symptoms of the inequity of structure. But meanwhile, we as grassroots nonprofits, we also want to be conceiving of the radical transformation, the paradigm shifts with government, so that we're not just in the trenches, but that we're also at the boardrooms with the decision makers, the power players who are helping conceive of the big paradigm shifts that really chip away at the socioeconomic racial disparities that create food deserts, that create 50% higher recidivism rates. And I'm just wondering, one last question is, you mentioned the model. What more can both our supporters and those in the staff like IMAN begin to do about the model we're building here in Chicago and Atlanta to be part of more of the paradigm transformation conversation?
Yeah, well, I think, you all do a fantastic job of keeping folks in government, both at the executive level, at the state agencies, and the General Assembly members, as well as private philanthropy, engaged and educated, right? I mean, this work is all about understanding what actually happens on the ground. I'm no longer on the ground in the front lines, right? I miss that, right? You all are engaged every single day with the individuals who are demanding, who can voice, this is what I want and need in order to be my best self in community and for my family. And so we need to have those voices at the table, both, nothing about us without us, right? So actual users, consumers at the table, but also those folks like yourself, like Dr. Sophia, individuals who are working alongside folks in community, engaging, educating us, and taking it back, right? So taking back these conversations, these discussions, and say, this is what else we need. Earlier in the evening, we heard about your work in Georgia, and I'm just gonna say it again. I mean, voting, how important is that? It was unfortunate here in Illinois, we did not pass the fair tax. And that's gonna have significant impact on what we do in this state when we think about our state budget. Those are gonna be awful decisions that we're gonna have to make unless something significantly different shifts. And who are gonna be the people that are most impacted again, right? And so you have a governor, you have an administration that wants to fight against that. Well, we need our partners in the legislature to understand that. We need the citizenry to understand that. We need folks to come out and engage and understand what does it mean to appropriate tax people at the right rates. It's unfortunate that happened, but I think we're gonna have a lot of work to do together over the next 2 years as we climb out of the pandemic, as we climb out of a looming recession so that we can get to these conversations of transformation.
Yeah, I'm going to turn to my colleagues here in a moment, but I want to leave with that, at least, and we'll come back for a summary kind of reflection from you after you get a chance to hear some of my colleagues respond to some thoughts. But I hear engage, I hear inform, but I also hear in the word that you hinted at without saying is accountable, right?
Yes.
As a grassroots organizer, once you become an elected official, we need to hold you accountable, right? You're our friend, but we hold all of our elected officials and all those in philanthropy. I sit on a major board, a philanthropic board that funds organizing across the country, but we need to be held accountable. And those of us who are leading nonprofits need to be held accountable. We saw a lot of discourse about Black Lives Matters across this last year. And I think, now we need to be held accountable to those hashtags, to that discourse, to the proclamations that those lives in fact matter, and be able to say, what does that look like on the ground when we're going to have to make those critical decisions about budget cuts? How do we create equity in a way that really doesn't further devastate communities that have already been historically devastated? So I think that conversation is critical. I want to turn to maybe get some thoughts from my colleagues here, maybe starting with Dr. Sophia Adawi, who is the director of our health center. Sophia, you came on over 2 years ago now. You were working in a phenomenal federally qualified health center on the west side, historic center, Miles Square. You came on, you ushered this health center into becoming a FQHC, federally qualified lookalike. And then last year, on September 11th, no less, on that date, we were notified that we were the only nonprofit health lookalike in the state of Illinois to win the full federally qualified healthcare status. That designation, little did we know, profoundly shaped how we were able to respond this year. But nonetheless, it's been an extraordinarily challenging year, but you've done a phenomenal job in both pivoting and adjusting. Can you speak to some of the things that we were able to adjust to and what we're doing holistically to prepare for this upcoming year that we still anticipate being, if not as challenging, certainly very, very difficult?
Sure. So, when COVID first hit, as we like to say, we, just like all the other health centers, had no PPE. We had no way to keep our patients safe, let alone our staff. And so we virtually overnight had to incorporate telehealth services to make sure that we didn't have a single day of interruption in the services that were being provided to our patients. And that's something I'm really proud of. And our team really rose to the occasion and continuously asked, what more can I do? Give me more work. Tell me what else we need. And I think one of the ways that has been very clearly reflected, as with any health center, one of the things that we do is we very closely monitor our quality metrics. How are we doing on managing diabetes? How are we doing on managing blood pressure? And a host of other things. And especially at a place like IMAN, we do it so holistically that, it's really important to say that incorporating all of those other pieces of a person's well-being doesn't shortchange the quality of care that we offer. And despite the challenges of this year and having to have a hybrid model of virtual and in-person care, our quality measures haven't suffered at all, and we're really proud of that. With regard to the year ahead, I think the one thing that's on everyone's mind right now is the COVID vaccine, right? And so thinking about in a community like ours, where there are so many barriers to just regular care, let alone an initiative like this, how are we going to rise to meet that moment? How are we going to catch people up on the healthcare that they've been missing out on for the past year, that they've been delaying for a variety of reasons? And so we've been thinking about that and planning for it and thinking about how are we going to get people vaccinated for COVID? How are we going to get them caught up on their other vaccines? How are we going to make sure that all the other chronic conditions they have are being addressed? How are we making sure that, when people have stopped thinking about their food security or their the whole host of other things that have come up in this moment, we're going to continue to address those things and ask those questions of our patients and make sure that we're helping with that. And the other big one that I think is really important for people to think about and that we've really been planning and gearing up for. We're already seeing such a crisis in mental health with the moment that we're in. And we have a plan that we're moving forward with that is going to, again, bring that holistic, wraparound, multifaceted approach to people's physical, mental well-being, knowing that the need is going to be higher than ever.
Yeah. Well, and I think it's that approach that you talked about that continues to bring, and I always am just both surprised and inspired by the number of people that come to our health center physically and certainly virtually that literally pass up in some cases, so like literally 10 other FQHCs that are much more structurally built out than we are. And it really does say something to the kind of model that you've been able to continue to champion here with Natalie Rahman, our Director of Health Center, that's working and directly reporting to you and incorporating this really holistic primary care, behavioral health continuity that really speaks to the whole person. And even things like art therapy and organizing, I think that model really, as well as all the cultural competence that allows Arabic speakers, Spanish speakers, local folks from all over the city to come here and feel like they are not just at a clinic, but they really are getting healthcare from family. And I always hear that, even as I randomly just stop in. So thank you for all the extraordinary work. I know personally we've had lots of conversations about how difficult and taxing it has been for you and your team, but you've just been phenomenal. So I just want to publicly tonight at the end of the year acknowledge all the extraordinary work you've done, Dr. Sophia. Big snaps to you. All right. And Teneshay Coleman, who is now our interim director of Green Reentry. You've been with Green Reentry and IMAN in a number of capacities. As mentioned in the video, Teneshay, this was a gut-wrenching year, especially after it seemed like we had the brutal death of George Floyd, and then in those almost one after the other, lost 3 young men week after week that were young, rising participants in our program who were trying to do the right thing. And I know it was grueling, and some of our participants, as you heard in the video, pushed us about they need to be back on site. They couldn't do this virtual learning. They wanted to be more engaged. Speak to how you saw Green Reentry respond this year to that crisis.
Yeah, so just to really take that moment and address the fact that, we lost 3 individuals that we're trying to change. And Green Reentry is just a holistic approach to how we address all of that. I mean, we have our construction training center, we have our housing program, we also have intervention outreach that addresses the violence in the communities. So with that approach, we knew just with those disparities alone that we were already dealing with as an organization, we knew that with this pandemic, we still had to have that same energy to address that. So we did have to create that hybrid model where we were addressing some things virtually and some things in actually the trainings in our our training center. Yeah. So, it's really one of those situations where we had to hear the voices of our participant leaders, and at the same time, make sure they were safe. So they're in our space. We actually have physical distancing. We deal with all of the training as well. And then also still the wraparound support services with behavioral health and their case management, and then helping them address that. Right. We do still, like with intervention outreach, again, very important to make sure that we're still connecting and supporting our participants, but also looking back to the community for that support. And we have wonderful committed staff in Green Reentry as well that helps to address all of that that's been going on lately.
Yeah.
So, again, those deaths that happened back to back, they were heart-wrenching. And again, had a real eye-opening moment, where we said, we can't keep letting this happen. We have to bring them back. We have to have them engaged and give them that hands-on, and also still just support them and give them that virtual hug, even though we can't do it really, but still just making sure that they knew that they had a support system here.
Well, you've done a phenomenal job. The entire team, of Green Reentry that now consists of 20 full-time staff members from, like you said, outreach workers to the housing specialists to the comprehensive connection with behavioral health in the health center, case managers, to the Green Reentry Weekend Warriors program, which literally it's 7:45 now p.m. on a Saturday night. And we have Green Reentry participants right now who will be coming back from Daly Community College, who are part of a program that even in spite of the pandemic, we were able to sustain, which is amazing, where they're getting training, the comprehensive wraparound Green Reentry signature training, along with the college credits in welding, and being introduced to a trajectory in college that, you know, our friend and longtime organizer and now chancellor of City Colleges, Juan Salgado, has helped us really champion that program. And so it's things like that that even in spite of the pain, as you mentioned, gives us hope that Green Reentry is in fact everything that this population and that we all really need. And so with that, I'm going to turn to one of the Green Reentry participants, graduates, alum, our dear beloved Jake Hatton, who now is also on location at and working and building with his bare hands the Fresh Market. It's, you know, building for us, by us. Jake, you exemplify that. You've been the center of lots of conversations. You've led politicos and media on tours of our sites. And the day after that horrific death of George Floyd and all the unrest in the city, you had to make a difficult decision, but you showed up at work at 6 a.m. the next day after everything else. The city was literally on fire. People were blowing things up. You showed up along with your team. Why was that work so significant and meaningful for you that day and since the day since? And why is this program such a critically important program in terms of not just for those who are building, but for those who are watching that building happening?
Thank you. The day of and the day after the murder of George Floyd, it was a lot of shock, a lot of anger, and emotions at an all-time high. And I had to make a decision to either be a part of the problem or be a part of the solution. So instead of tearing down the community, I decided to help build the community with my IMAN team. And I think that's one of the most amazing things that could have happened, of just being there, being at work, showing the community that brothers like myself don't want to be out here doing crazy things. We want to be positive, start making a career, provide for our families. And Green Reentry has given me the opportunity and so many other brothers to do those exact things. And that's why, hey man, it's so many examples of greatness. So with that being said, you know, those are some of the reasons why I think that IMAN is.
And like you said, Jake, you know, I remember because I came by that morning.
Mm-hmm.
I was riding around that night. In certain parts of our neighborhood, people had to stand out in front of the buildings. We didn't have to do that in front of the Fresh Market. It's kind of like the community understood. This is being built for the community, by the community. And the next morning, like you said, while everyone was boarding everything up, I think the only thing that was being built up on that street, uninterrupted, was the Fresh Market. And everyone showed up, like in this extraordinary spirit. I remember how it felt. I was, like everyone, just overwhelmed by what had happened the 24 hours. But I remember stepping into that space, watching you build out that window that next morning, and just being just completely transformed and inspired by the energy. And in some ways, Senna, maybe it's a good segue to you, as director of our strategic initiatives. You know, Go Green on Racine is perhaps the most ambitious, significant grassroots community development project that we've certainly been involved in over 2 decades. You have been really the architect of drafting that vision, along with our phenomenal partners at Teamwork Inglewood, at Rage and E.G. Woods. And in some ways, you know, the disinvestment, what I sometimes call the criminal disinvestment, because it is a criminal offense, that we have abandoned train stations, abandoned schools, abandoned lots. And yet, Go Green on Racine this year has meant so much to so many of the residents. Speak to why you see it as why is it such a significant and resonant community development plan? Would you care to share some thoughts on that?
Yeah, I mean, think about just what you said and also what Jake just said. Go Green on Racine has been so exciting, and that has totally flipped the paradigm on development. Often development emerges from affluent developers and with market interests, but this is an example of development that is driven by the people, that is rooted in community, that is driven by the good intentions of people like Jake, like he was just describing. It's about development that is holistic in the sense that it addresses multiple aspects of well-being, housing, health, transportation, safety, food, all of these things that are life-giving, so that when we build something like the Fresh Market, we're not just building a grocery store. We're building a hub for health and wellness programming. We're building a fund for food security so that residents can walk in and without, even if they don't have the ability to pay, can still have a dignified shopping experience. We're also creating a center for a platform for local food entrepreneurs. And when we think about something like the Regenerator, that when we take a closed and dilapidated school like Woods Academy that has been closed since 2013, and we transform it into something like the Regenerator, which becomes a hub for housing, reentry services, for green enterprise, serving thousands of men and women who are coming home after serving sentences in the middle of a pandemic with little to no access to resources. It's not just about a housing vision, Go Green on Racine. It's about creating home ownership pipelines for residents. It's not just about revitalizing assets, but it's also about organizing to redress wrongs, like the closure of the CTA Green Line station. And it's about mobilizing to reopen that station so that Inglewood residents have access to the same jobs, the 1 million jobs that Northside residents have access to. Go Green on Racine is not just a community development project, although it is that. And it's not just about calling out systemic inequities and injustices, although it is that. But it's essentially, and most importantly, it's about calling to a reality that is different and more just, and a reality that gives our community the opportunity to build what we deserve. And when I think about the prophetic narration about, if the final hour was to come upon you and you have a sapling in your hand, plant it. At this time, when so much of what we have built is crumbling and falling apart, to build something right and to build it with love and to build it with brothers like Jake and our partners in Inglewood, and to build it with the people across the country who have been making $5, $10, and $15 donations every day, this is a sacred endeavor.
And when I hear you talk about that, and I think about this comprehensive, holistic healing model, we're in the art studio, we're in the ceramic studio, you have this phenomenal art. We talk about art as this vision to radically reimagine the world as it could be, but so much of our organizing work, that ethos is so embedded in our organizing. So you spoke and have spoken so comprehensively about the idea of healing. In IMAN's mission statement is this idea about this holistic model, about being a model for health, wellness, and healing. I think all together, we see all this work, whether it's the health center, the organizing, the art, as a comprehensive model to deal with the deep divides and hurt and pain about healing in this country, in the state, in the city, to serve as a model. And I just would, as a closeout thought before we turn to our Deputy Director Shamar in Inglewood, what are some closeout takeaways that you'd like to offer to some of the staff that you heard?
Yeah, well,
today?
first, I'd like to just say I'm so inspired and so moved by all of you and the work that you're doing. And I can't wait to see what happens next. And I can't wait to be a part of that. And I know that our state only succeeds when we have partners like you all and like IMAN. So I would say continue to engage us, continue to have us walk alongside you as partners in all the work that you'll have to get done, right? It's more than just money. Money's important, but there'll also be policy, there'll be legislation, there'll be other influence that elected officials will be able to bring and bear to the work. I'd also like to say we need your help. You heard Dr. Sophia talk about it a little bit, but the state will need your help as trusted messengers on the ground so that we provide individuals in community with the information and education that they need to make the choices around taking the COVID-19 vaccine. We cannot do that on our own, right? And they will trust you all. And so we ask you for that partnership. And then we ask you for how do we get past this, right? It will take a long time. The vaccine is coming in drips and drabs. And so we have to continue this fight against the virus over the next 9, maybe 10 months. And so how will we continue to be physically distant, but socially connected? And so we really look forward to that continued dialogue and partnership with IMAN.
Thank you so much again for being here tonight. It really means a tremendous amount. And we will definitely walk with you. We will challenge you as you challenge ourselves to hold ourselves accountable to that kind of transformation model that I know we're capable of in a state like Illinois and God willing in Georgia as well and across this country. I want, before I turn over back to, as we close out tonight and turn to our Deputy Director in Inglewood, just once again, thank each and every one of you who, from me personally, who many of whom I've known many of you that have been on the Zoom call, some for decades, some in the last 3 or 5 years. I see you believed in this work. You've helped us. You've held us accountable. We've had partners in philanthropy, partners in community, partners who have challenged us, leaders who have challenged us. It's one thing to aspire, it's one thing to articulate certain high-minded ethics and values and principles. It's another thing to live those out day in, day out. And it takes an extraordinary kind of community, both here on the ground, in the trenches, but in positions of power, positions of influence across the country. And you have been those people. We ask that you continue to pray for us. Thank you for all those sponsors, some of which you'll see listed at the end of this program. Others come back to our website. They were coming in at the last minute. We're going to continue to lift up those sponsors as helping us meet our year-end goal. I want to thank, as we go to Inglewood, again, one of the most inspiring programs and visions that you heard, Senate, that I've had opportunity to be a part of, in great part because it's not just a vision that's being crafted from a 25th floor in a downtown building. It is really being crafted by the community, for the community, by leaders like, Asia Butler, Rage, and Cecile DeMello, Teamwork Inglewood, and our friend Dion and E.G. Woods, and all the countless organizers. Thank you all for being part of this effort. And without further ado, let me turn it over to our Deputy Director, one of our 3 extraordinary Deputy Directors, Shamar Hemphill, right in the heart of Inglewood, and what's soon to be our full fresh market, which we hope you come and support by spring 2021. So turn it over to Shamar.
Assalamu alaikum, peace and blessings. My name is Shamar Hemphill. I'm one of IMAN's deputy directors. I'm here joining you all from the south side of Chicago at our Fresh Market site here in Inglewood, where our alumni participant leaders from our Green Entry program are hard at work with our partners at Ujamaa Construction. We're really excited about this because we'll be unveiling this in 2021. So stay tuned for that. But like the video you just saw and the words you just heard in the video, we've had to dig deep. We've had to be creative in this moment, in this challenging time, to meet the needs in our communities, both in Chicago and Atlanta. But we know that we couldn't be creative and we couldn't dig deep without your support, without hundreds of you believing in the model, the impact that we've been able to have in 2020 and God willing in 2021 and beyond. But in order to continue to dig deep, we're asking you to dig deep. We're asking you to go to our website, www.imancentral.org. Tell everyone you know, your friends, family, we are on the cusp of powerful, powerful things from a grassroots level of really building our communities back up with the people that's there. I've had the pleasure this evening of closing you out, being with you all, virtually and not in person. And this is still monumental to us, and we thank the Most High that we're able to gather. But before I close out, I do want to leave you all with a present and a gift from our Executive Director, Rami Nashashibi, and our IMAN artist roster, Drea Denor. A video, Mama Please, if you haven't seen it already, it was aired on BET. And now you get a chance to see it as we close out the night. So sit back, enjoy, and relax, and see this powerful artistic expression And again, remember us in your prayers, and we pray that the Most High continue to bless us. Thank you. Assalamu alaikum.
Little Mahmoud on his way to school. Uzi submachine guns, boy, don't you move. Threw off his pack, slipped on the cracks. Hands in the air, bullet in his back. Mama, please, I can't breathe. Get these demons off of me. Got the knee on my neck, I'm on the ledge. Baby, come home, don't feel that death. Ooh, the police, dogs off the leash. Maria begging, don't take my Louise. Cold and afraid, getting again. Ripping the sky, praying to be saved. Just crying. I can't breathe. Ooh, nothing on the ledge. Honey, come on. Oh, oh.
George had him, George. Think of me. She could have been one. She should have been one. Instead of himself, she didn't turn into a martyr. We never chose these parents. They turned me into an artist. They got a knee on our neck. I got a foot on the neck. They gotta deal with it there. They gotta cut us a check. From Breonna's law to Carrier's law, I dare you to draw. My area's raw. Youngest can dream on, from Iman to beyond. They must have forgotten everything we on. We can't be sorry. I lead around me. City was changed by a visit from Dolly. Want me to suffer and scream for my mommy. They must have forgotten everything I be. I'm a descendant of slavery. I'm a descendant of trauma. I'm a descendant of Shonda. That's my mama. 400 years. That's our trauma. Millions of tears. That's my mama. 400 years. That's our trauma. Feeling the fears. That's my mama. 400 years. That's our trauma. Feeling despair. That's my mama. 400 years. That's our trauma. Trillions repair. That's our mama. Mama, please, I can't breathe. Get these demons off of me. They got their knee on the necks. We're on the ledge. Babies, come on, don't fear their death. Mama, please, I can't breathe. Get these demons off of me. They got their knee on the necks. We're on the ledge. Babies, come on, don't fear their death. Mama, can't breathe. Get these demons off of me. They got the knee on your neck. You're on the edge. Baby, come on, man, don't be the dead.
Thank you all so much. Thank everyone for being here. Thank everyone for joining. Thank you all so much. We're so grateful to be able to connect, to have been able to engage with y'all over the chat and the comments. I pray, please keep us in your prayers. Please keep the community in your prayers, and please do click on that link. Please do share generously, support this work generously, and also share the video that we will be making public soon, as well as about this work. Word of mouth helps so much. Your donations help so much. Your prayers help so much. I want to thank everyone and all of you for being here. We are going to end shortly, so you can say your goodbyes, but thank you all so much again. Peace and blessings. Assalamu alaikum.